My name is Vivian, and today I'll be filming a What's in My Bag Dental Student Edition. So I'm a third-year dental student at the University of Queensland, and I thought it would be cool to kind of tell you what's in my clinic bag, which is the bag that we use like when we're practicing on little mannequins with teeth and stuff, and also what's in my bag for like my everyday, thing. So the first thing I have is this plastic mouth thing. It goes around like a head and it simulates having cheeks, so you can like retract the cheek when you're working in the mouth, like in here. And then this is a little chute thing that squirts out water into the suction that you hook up to here. They give everyone one of these, and then you just have to return them at the end, like when you're done your degree. Unfortunately, I was drilling and I like cut the little bit here. But don't worry, I won't be doing that on patients. I did that like a few years ago, like in first year, so safe to say I'm in third year now. We're okay. We've actually got our teeth. We magnetically attach this part onto our models, and then you can just kind of see all the work I've done. The white that you see on there is actually from whiteout that we put in first year. It's to simulate plaque, and I didn't end up getting it all off because apparently whiteout doesn't come off of this thing very easily. So every clinic session we gotta attach these. I also have the bottom one. You can actually see all my teeth in this bag that I prepared. I have a lot of teeth over the years. It's a little bit crazy in here. We have a little screwdriver here that unscrews the teeth, and then you can put the teeth in, like new teeth that you haven't worked on yet. So I've taken out one of the teeth for you to see. It's just like a hole, and then you just screw another tooth in with the screwdriver. This is pretty magnetic. As you can see, it's like sticking to the screwdriver. So that would be the lower arch that we work on. And again, there's a lot of whiteout everywhere, sorry, from first year. You can actually see the progression of how badly I used to be with my practical skills, especially when starting something out. But I have a few good ones in here. I did this one in first year. It is a class 1 on a molar tooth. And then, this is probably my worst crown prep that I did. So this one was really bad. It was probably like my second one, and I like screwed up on one part, and I was like, oh my god, I don't want to keep going, so I just started drilling randomly because I was really annoyed. But then I started getting significantly better with all the crown prep, and I ended up doing really well on my practical for it. So here's another one. So as you can see, I definitely improved as time went on. That is a crown prep. Incisal restoration that I did in second year. We also have these little bags that you can buy teeth from a vending machine, like in the clinic. They just contain a bunch of new teeth that you use to replace the teeth in here. We have our lab coat that we wear. It has the UQ logo on it over here. Yeah, so I just wear this in class. And then we have to put our hair up. We also have clinic shoes that we need to wear, and we have to wear professional attire. So this definitely would not fly. I have spaghetti straps, which is a no-go, and a quite revealing chest line. We also have to take off any jewelry. Definitely no Apple Watch, no bracelet. I've got my dental student ID here, which I wear like on the side here. I don't always wear it. I think you're supposed to, but people kind of stopped. Okay. And then we have this thing. So this is actually from first year. They teach us how to drill on these practice blocks. So these ones have a bunch of different patterns that you can trace out with a drill. There's a bunch of different layers of this thing. Enamel, dentine, pulp. Pulp is obviously red. You just kind of screw on, I think. Actually, I forgot what this is for. Drill in the holes, trace all the lines, and the goal is to not go past the black line. So I've done pretty decently here, and then you can just practice on the edges. And they tell you how many millimeters of depth you need to actually drill to. We have an assessment on this one, but I didn't actually do all of them, as you can see. I didn't do that one. So the black is obviously caries. that you stimulate. I've also got like heaps of papers. I mean, as you can see, I'm not like the most organized in terms of my clinic bag. I just kind of chuck stuff in there. But my normal everyday school bag is a lot more organized actually. We've got like assessment sheets for endo, which is operating within teeth, removing the pulp and like cleaning the infection. We have to do it to certain specifications. Before I went to dental school, I didn't realize how intense it was in terms of measurements. You really have to get all the sizings correctly with your instruments, making sure you're not drilling too much or too little. It's pretty specific. You need to take like radiographs, so a bunch of x-rays of the teeth. We actually put the teeth into like blocks here. We have to check how big the canal is. I don't think any of this makes sense to people who don't do dentistry, but to those who do, I mean, all of this will make sense to you. This one, you can see the instrument going down into the canal, and here I'm just checking to make sure it goes all the way to the bottom of it. It's kind of there. Maybe I might be able to go a bit more, but yeah, I usually ask the supervisor to make sure I'm on the right track. Oh, that one's a bit better. That one's nicely at the apex. Sometimes they give us instruction sheets about what we need to do in the day. This is when we started doing endo on a premolar tooth. Yeah, and then they give us like a little diagram explaining the structure of a premolar tooth so that we make sure that when we're removing the pulp and everything, we're not perforating. So that just means accidentally taking the instrument through part of the tooth that we should not be taking it through. I should probably organize these, but to be honest, I've done this so many times it's in my head now. I don't really need the sheets anymore. For exams, we have a rubric, and we need to do it to certain specifications. It's really stressful during exams because you have to take the x-rays like during the exam, but everybody needs to also take x-rays, and there's only like 2 x-ray machines in the room, and if you want like more access to x-ray machines, you have to go to the other room. So you're wasting time trying to go back and forth, and there have been times where I've fully forgotten an x-ray in the exam, and like I lost some marks because documentation is also like part of the marking criteria. I still did pretty well. I would consider myself pretty good at practical stuff and pretty bad at theory stuff. Yeah, my exams are not the best. But I think everybody has their strengths and their weaknesses. Anyways, now I've got this little holder case. In it contains all of the instruments I use in the preclinical sessions. So in preclinic, we don't do anything within people's mouths, it's just all mannequin work, so you don't need to sterilize these instruments. A lot of different instruments here. I doubt anyone knows what they mean unless you do dentistry, but it's just like the standard like restoration stuff. You use this to just check in the mouth for cavities, or just checking the integrity of restorations or whatever you want to do. So this one's pretty cool. You can actually unscrew the head here when your mirror gets like dirty. So I have a pack of new mirrors that I use. I haven't gone through all of them actually. We also have a matrix band. So this is just used to make sure the walls of your restoration adapt to the tooth structure. There's more, but I'm not going to take them all out because I'm sure half of you don't even understand what all the tools are for. We also have some worksheets that we use to know how to make dentures and design them. To be honest, didn't really use the pieces of paper. I just kind of read up about it and used the lecture slides. But there is a sheet similar to this one that we do need to fill out when we are making dentures in clinic. And then I've got an extra pair of safety glasses, and we also wear gloves and a mask during the preclinical session. Personally, I've had these for a long time. I do have my new main glasses, which are called Hoggies. I keep these ones in my main bag. It comes with a cute carrying case. As you can see, they're pink. They give you a full range of view. As you can see, it's fully clear on this side. So when you're wearing them, you aren't annoyed by all the rims and stuff. You can see everything, and it's nice. If you go to the University of Queensland, the University of Queensland Dental Student Association sells them for a discounted price, like somewhere in the middle of the year, and then I got them from them, so we can go ahead and do that. That's it for my clinic bag. Okay, so on to my actual school bag. I have a Rain's backpack. I have this really cute little no face. If you guys have seen Spirited Away, yes, I Like You. I actually got this one at a cute arcade in the city. I actually only did it 2 times, like the claw machine, and somehow won on my second try, which has never happened because that was actually my first claw machine. So if you open this up, you have your main pocket, which contains my laptop case. In it we have my iPad, which I use to take notes. I've also got my Apple Pencil to write stuff in my iPad, and my laptop. Eventually you'll notice that all of my stuff are pink because I'm obsessed with pink. I like having everything nice and coordinated. I've got my Nintendo 3DS that I use to play Animal Crossing because I love that game and sometimes I play it on the bus. I have my Beats, so I'll just wear these on the bus. Yeah, just listen to some music because music is great. Music is some good vibes. I've also got my portable battery pack here. This is a Xiaomi 15,000, I don't even know, NAH. I've actually got little stickers. I teach piano on the side, so I like having stickers so that my students can put them on every song that they complete. I also got an Apple Watch, pink of course. I've got a notebook, which I use just to take jot notes. I used to use notebooks to do more note taking, but I've since gone fully digital. But sometimes I do switch back. Maybe I can make another video on how my note-taking style has changed over the last 3 years in dental school. Pencil case. It looks pretty gross at the moment because all of my pens leaked. But I've got colored pencils in here, a bunch of Muji pens. I also got this pen. It is a sushi pen from Japan. I like my cute pens. Really cute Totoro. I've also got my gym towel and resistance band for gym. So I got this from Gymshark, this from Lorna Jane, and this is also from Lorna Jane. Yeah. So I've got my card case. It's a Muji one. This contains all of my cards and deodorant because obviously if I gym, I will need to make sure I don't smell bad. I also have this, which is a cute little mirror my friend got me. I've also got some moisturizer. Then I've got this folder. It's not dentistry related, but I like learning scripts and stuff. It's a pretty new hobby of mine, but I take acting classes on the side. This is kind of just my workbook filled with all the scripts I need to learn for class or for auditions that I'm doing outside of school. Then around exam times, I like to put my notes in a paper form, so I write them on my iPad and then I print them and then they bind it for me, and then I just like to review it. I like doing the Cornell note-taking style. If you guys want a video on how I take my notes and everything, just let me know. I have a few other booklets for other courses that I use. So yeah, that's that. And then I have my locker key, which I put just on an elastic that broke, but I mean, it works. And I keep my clinic shoes in my locker, and during the year I keep my clinic bag in there. And I bring my lunch bag to uni, especially on full days where I don't have time to like go home. I'll heat it up and then I'll eat my lunch. It's pretty cute. It's a panda with like a little tail at the back here. I love it. Yeah, so that's what's in my bag. I hope you enjoyed. I'd like to make more videos, maybe on my dental life or life outside of dentistry. Maybe do some music stuff, I'm not sure. But this channel is gonna undergo somewhat of a change. I'm coming back after 3 years, and the whole YouTube thing's a little bit, you know, foreign to me now. So I guess this marks the start of something new. So I hope you enjoyed, and hope to see you in the next video. Like, comment, subscribe. Yay! Bye, YouTube.